Hi, I'm Janet Getson. I'm a music therapist, and today I'd like to talk to you about music therapy in palliative and hospice care. The first thing is music therapy. We are trained. We have usually we have a bachelor's degree in either music or art, and some music therapists go on and get master's degree or even PhD. And after we complete our coursework, then we have to do a 6-month internship, and then we have to take a board certification test. And then every 5 years, we either have to take the test again, or you have to do workshops and conferences to get credits. We have to get 100 credits every 5 years. Some states we are licensed in, and we're working on getting licensed in more states. We're hoping Pennsylvania will follow through now that Ohio just got licensed, and that will help us get reimbursed from Medicare and other insurances, just like physical therapists and occupational therapists, how they get reimbursed, speech therapists. Right now, there is a way you can get reimbursed, but it's kind of tricky, so hopefully that will be something in the future for Pennsylvania. In American Music Therapy Association, they did a poll a couple of years ago, and 25% of music therapists are working in hospice, at least part-time, and 62.2% of hospices and home health agencies offer music therapy in the United States, with music therapy being the third most offered complementary and alternative therapy. But in Erie County, as far as I know, there are 0% music therapists working in hospice and palliative care at this time. Music therapy in palliative and hospice care is a clinical and evidence-based therapy backed by research which uses music interventions to meet the psychosocial and physical needs of the patients. We also work in the interdisciplinary team, and music therapy extends to all branches of the palliative and hospice program, including home care, inpatient care, and bereavement. There is no skill that the patients need to be in music therapy. They don't have to be musicians, singers, anybody can do it. I have never met anybody who has led a life without music, so music therapy is a good tool. Palliative and hospice goals, which music therapists can address, include, but aren't limited to, social. We can reduce feelings of isolation, boredom, and loneliness, support and encourage interactions, provide opportunities for self-expression. Another goal would be some emotional goals, helping with anxiety, depression, fear, anger, frustration. Cognitive goals, confusion, disorientation, neurological difficulties, and impairments. Physical goals can be used to reduce pain, address shortness of breath, lower blood pressure and heart rate, and promote relaxation. Spiritual needs for rituals, lack of connection, support their beliefs and needs, and also bereavement, where we can work with the patients and the families. To achieve these goals, music therapists use methods that include improvisation, music and guided imagery, relaxation techniques, lyric analysis, songwriting, instrument playing, singing, life review, reminiscence, legacy work, sensory stimulation, and even just music listening. I'm going to discuss these more in depth later. So the first step in music therapy clinical process is assessment. The music therapist gathers information from the patient, family, and caregivers. And the music therapist can also look for, during the assessment with the patient, for physical symptoms, cognitive and communication ability, psychosocial needs and concerns, spiritual preferences, musical preferences and background, individual trauma, history, and triggers of that. Music therapists can utilize different scales to assess pain levels, such as the NRS, which is the numerical rating scale, the FACES, FACES scale, the VAS, which is visual analog scale. The next step in the music therapy process is to come up with a treatment plan. The music therapist develops a plan for individualized goals and objectives for therapeutic needs of the patient and family, the family members' ages and developmental levels, the physical and cognitive abilities, including sensory processing issues or needs, and trauma triggers. The music therapist's theoretical orientation also plays a role in treatment planning, as music therapists may work from a humanistic, a behavioral, a neurological, psychodynamic, or integrative model. Like when I went to school, we actually learned the behavior modification techniques, which is not appropriate for hospice and palliative care patients. So now I use a more humanistic approach. Music therapy is not intrusive, non-threatening. Instead of being a given treatment, the patient becomes active and involved in their treatment. So some of the techniques and activities include improvisation, which I talked about before, but I'm going to go into more depth. Music therapy is different from other therapies in that the patient and the therapist, they improv music together. The patient chooses an instrument and the therapist joins in at some point, meeting their melody and or rhythm or echoing. And I have a variety of instruments on the table that they could choose. Here's an ocean drum, which is pretty loud, but usually cover it up with a cloth of some kind. It's very loud. A lot of patients like to use drums. Or they might want to sit at the keyboard and do some improvisation. We have these things called boomwhackers. They're all toned. And they're different lengths. Like this is a D and this is an F. And you bang them on. And then I have some other things like maracas, bells. There's a frog. Whatever they want to choose. If the patient has a long-term illness, they may have increased disability, leading to increased dependence on others. And research has shown through improvisation that patients reported heightened experience of ownership and skill and success and achievement. Music therapy and guided imagery. We are trained in our background in school and things, but you can do more extensive work with some people it's called the Bonnie method. So usually you use classical music or other slow kind of relaxing music. The music therapist can guide the patient to relax from head to toe and then picture a place that from their own experience that is a relaxing place for them. It helps reduce anxiety, can lower blood pressure, assist with their breathing, and reduce pain. It also helps them relax and distract and could also alter their mood. Writing can be therapeutic, and so songwriting can also be therapeutic if the patient wants to write a poem, a story, or even just their feelings. The music therapist can help make it into a song. They could write a song to leave for their families. They could use a familiar melody, life stories. They could enhance sense of personal value. It helps attribute about self, messages to family members, and the opportunity for resolution. There's also lyric analysis, which the patient can pick a favorite song and just discuss what the lyrics mean, what they mean to them. Instrument playing, individually or as a group, promotes creativity, self-expression, and emotional release. It provides opportunity to vent energy, either positive or negative. For an example, they could choose to play a drum or the piano, and the music therapist could offer a unique way to express feelings that can't be conveyed into words. Singing, they could sing along with the music therapist, which just when you're singing, it helps improve your breathing because you take in more air. Relaxation, it provides a sense of social connection. Letting patients choose the songs gives them some control back in their lives, which they have no control over a lot of things, being sick, and this gives them something that they can control. It provides a non-threatening and creative medium which they can experience and express emotions. And listening to music, patients may choose soothing or calming music or music that has personal significance to them. Recorded or live music can give patients opportunities to experience positive alterations to their physical, emotional, and/or spiritual state. Low-pitched music helps with agitation and anxiety. Rhythm and tempo can help with respiratory difficulties. For an example, if you gradually reduce the tempo to 60 beats or less per minute, it will help with their respiratory problems. Even when a patient is very weak, they can still be agitated. Soothing music helps them quiet down and be in a more relaxed state. For an example, the music therapist starts with the tempo they're at. We always do that. We go in, and if they're agitated or breathing rapidly, you start with the music, you match them where they are at, and then slowly bring down the tempo. Listening to music can help reduce anxiety and stress and promote feelings of happiness and well-being. It can also distract patients from pain and discomfort. Another technique is life review and reminiscence. As death approaches, patients often need to explore their spiritual dimensions, either consciously or unconsciously. When they review their lives, they can reflect on the achievements they've made, regrets and failings, as well as their futures. So they may experience an understanding of life's meaning during the music therapy session. This is accomplished with the music therapist by singing, listening, and playing music together, and then discussing memories triggered by the music. Discussing the importance and relevance of memories and associations brought out by the music helps patients clarify their life's values. It also allows patients to feel their self-worth and gives meaning and purpose to their suffering. It can relieve discomfort and help achieve heightened self-awareness. Music therapy can gently guide patients in search of resolution, harmony, and peace. In legacy work, patients can leave songs that they created with the music therapist or videos of the music therapy sessions themselves. They can also plan music for their funeral. There's a music therapist named Brian Schreck, and in 2017, he created a thing called Heartbeat Songs. He was working in, I think, the Children's Hospital in Cincinnati and working with children that were dying. And he came up with a plan. He took a stethoscope and cut it, and he puts a microphone into the stethoscope, and then he can record the patient's heartbeat. Then he took the heartbeat and would put something over it or create a song with the patient or the patient's families and put it over it so that it's a song with the heartbeat of the patient. Their heartbeat is the basic rhythm for the song. You could also you could record unique sounds instead of the heartbeat. For an example, like if your mother would go to your football games and she whistled really loudly, and that was something that you remembered and were fond of, you could record that, put it in the song. Since then, there is a person that came up with the term for it. Instead of heartbeat songs, it's now called amplified cardiopulmonary recordings. Here's an example of a music therapy heartbeat song that we're allowed to use, that we got permission from Brian Schreck. Also, another thing is some music therapists have started to explore using music therapy alongside with virtual reality headsets, which I think is kind of interesting. I did a workshop on this a while back, and so it's the same kind of thing as the music and imagery, but they would actually be able to see a scene. It wouldn't be a scene that they would come up with in their head, but there was scenes like beach scenes, mountains, streams, oceans. So I think that's kind of an interesting thing that you're starting to look into. So in conclusion, music is an amazing tool in therapy, and it can act as a nonverbal catalyst to feelings present or buried. We can pull people out of their isolation and make it easier to share their joys and concerns. If you would like more information about music therapy, you can go to musictherapy.org, which is the website for the American Music Therapy Association. And for more information about palliative and hospice care, please go to juliahpc.com. You can also learn about our project for Julia House, which will be on that website. Thank you for your time today, and keep on singing.